Hi, my name is Ashley. These are the cards. My informative speech is about the foundations of nursing. My sources are Fundamental Nursing Skills and Concepts, the 9th edition by Barbara Timby. And the second is Theoretical Foundations of Nursing, Florence Nightingale. The hallmark of nursing is care. What nursing has to do is to put the patient in the best condition for nature to act upon him. Nightingale, 1859. Nursing is one of the youngest professions, but the oldest art. Nursing did not start out as nursing, which is why it would be the oldest art. It was assisting women in childbirth, suckling healthy newborns, ministering to the ill, aged, helpless, and homeless. It started in the Middle Ages in Europe by nuns and priests. Some of the rules of employment for nursing attendants in the Middle Ages were no dirt, rags, or bones to be thrown from windows. Nurses are to shift the bed and body linens of patients once every 2 weeks, their sheets every 4 days, and to change their drawers and stockings once a week or more often if necessary. Any nurse who disobeyed the orders, got drunk, neglected their patients, quarreled with men, would immediately be discharged. The Nightingale Reformation started in the Crimean War. Nightingale proposed to the Secretary of War the sick and injured soldiers be taken care of by a group of women trained in nursing skills. When they arrived at Scutari, the daily death rate was 60%. They cleaned, provided nutrition, sanitation, and ventilation, lowering the death rate to 1%. She received donations by the grateful servicemen and their families, which she then used to open the first training school for nurses at St. Thomas Hospital in England. She changed the negative image of nurses to a positive one by training people for their future work, selecting only those with upstanding characters as potential nurses, improving sanitary conditions for the sick and injured, providing classroom education and clinical teaching, she was an advocate of lifelong nursing education. Nursing in U.S. schools was any hospital, rural or urban, school that could establish a training. Student-staffed hospitals. They also worked without pay in return for training, which usually consisted of chores. Hospitals profited by eliminating the need to pay employees. There were no formal classes, and training was an outcome of work. The curriculum was unplanned and varied according to the current case. In Nightingale schools, training schools were affiliated with few select hospitals. They relied on employees to provide client care. The education costs were borne by students or endowed by the Nightingale Trust Funds. The training of nurses provided no financial advantages to the hospital. The class schedules were planned separately from practical experiences, and curriculum content was uniform. Contemporary nursing combines the art of nursing with science, integrating the nursing theory and by defining nursing. Florence Nightingale defined nursing as putting individuals in the best possible condition for nature to restore and preserve health. Virginia Henderson defined nursing as the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or to a peaceful death, that he could perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help them gain independence as rapidly possible. The American Nurses Association defines it: alleviation of suffering through the diagnosis and treatment of human responses to actual or potential health problems, advocacy in the care of individuals, families, communities, and populations. The educational ladder for nursing starts with practical nursing, which is a shorter nursing program that was created during World War II. They average between 12 and 18 months, and they are the shortest, most economical program. They work under the supervision of an RN. Registered nurses work under the direction of a physician and take 2+ years of college. The big thing with nursing is that there is a continuance of education throughout your career. You never stop learning. Nurses have many unique skills, which include comforting, counseling, and caring. And that's my history of nursing.